is still. Second thing, positive aspects I see, like despite all the efforts, environment was getting degraded day by day, and this corona has done a tremendous job as far as the correction or as far as the improvement in the environment is concerned. Okay. Second, very positive thing which I think is we as a human being took everything as a granted. Like environment is going to be environment is going to be supporting us. Whatever things we are doing with it. So I request participants kindly mute. There are some participants. There is a disturbance little bit. Okay, so I can see in Prayag that Ganga, despite all the efforts, all the program of the Ganga cleaning, it has not been so cleaned as we are actually seeing today. And anybody can take a holy dip in River Ganges here in Prayag, Sangam. And also we all know that environment has got tremendously improved. Second, and rather than the third thing, which I want to share with everybody, that the health has been ignored from long. So what I see is basically the people, the hackers, the shopkeepers, the vendors, they have suffered from the economic terms. But as far as the COVID-19 suffering is concerned, that means they being positive by this coronavirus, they have suffered least. The poor has suffered least in terms of the disease generated by this virus actually. So I have not seen any sabji wala or vendor or anything like that, and I found like they are actually corona positive. Mostly this was concentrated in the cities where the people have got the weak immunity. So this is a challenge, or this is an opportunity, I should say. Like everybody should think again. And also one thing, human beings has been blated by their ego that they are the most important and most precious animals or lives in this world, and they can go on doing whatever they wish and whatever they actually want. So that's not the case. Corona has made us learn that no, there are certain risks. Even a small virus which is invisible can put the brake to the many things which is actually not. I'm not saying that all of the things are destructive, but at least some of the activities of us were very destructive. So with this word, like that, we should take this coronavirus uh, as a positive event, which is going to guide us further how to live in this society, in this environment, taking nature as an unity, as a whole. So we are just an entity in the whole nature or in whole universe. Uh, that I want to that is all I wanted to share with you all. So just I would request, or I would again say that I state that it should be taken as an opportunity and a challenge, and do something good for the environment, for us, for the society, and go ahead. I once again welcome you all, and thank you all for listening me patiently. Thanks a lot. Thank you, Pragya.
Thank you, sir, for your valuable suggestions and their views. Now, I would like to invite to Dr. Chandra S. Sarma, Chairman of INYAS, Indian Academy of Sciences, as well as the faculty of IIIT Hyderabad. Sir, I welcome you. Please share your views on this webinar series.
Yeah, thank you. Thank you, Dr. Pragya. So I represent here the Indian National Young Academy of Sciences, INYAS. INYAS, to be very short, it was founded in 2014 by our parent academy, INSA, with 20 Indian young scientists. Currently, we have total 80 members, And among the different objectives, one of the major mandate for INYAS is science outreach and popularization. Last 8 to 9 months, we have been really testing time for all of us globally. And despite this global pandemic, I am really happy that INYAS has not only adapted to the online platform very effectively and quickly, not only for continuing our science outreach, but in fact increased our activity very significantly in this time. We have organized a number of webinars covering various disciplines and aspects related to the science education. We also took a major initiative with our parent academy INSA to initiate a new webinar series, Vigyan Setu, which is quite popular, to disseminate the more scientific information about COVID-19 through none other than the frontline scientists working in that area. Today, it's a special day. We all are celebrating Sir C.V. Raman's birthday, and it's indeed a pleasure for INYAS also. We took a new initiative today by initiating a new program, Scientists from India's Past and Present, in which we are highlighting the immense contribution of Indian scientists from the past on their birthday through online lectures covering their life and work. We shall also be highlighting the top quality science from our present Indian colleagues. And now we are starting this new series jointly with MNNIT Allahabad on COVID-19 and its different dimensions. I really thank Dr. Pankaj, our member, for this initiative, along with Dr. Pragya from MNIT
Yes, sir.
Allahabad. I'm sure this webinar series will give much more insight about SARS-CoV-2 virus to our viewers, as we all appreciate now that effect of this virus is not just limited to the physical health, but rather much more wider to our mental health, economy, social structure, and whatnot. Although total new cases as of now is decreasing and are now within 50K range from last couple of weeks, but there is an increase in the numbers again in the few states like Delhi. So we all need to be very, very careful even now. Daily, we are getting some new information coming to us, which is helping us to increase our understanding about this virus. And hence, this series is very timely to discuss the various aspects and dimensions of this global pandemic due to COVID-19. I welcome today's speaker, Professor Pankaj Seth, for his time and sharing his knowledge with all of us. And I once again thank Dr. Pankaj from INYAS and also MNNIT Allahabad to come together and to start this new series today. Thank you.
Thank you, sir. Thank you, sir, for your valuable suggestions and views. Now, I would like to invite our Honorable Director, Sir, MNIT Allahabad. Sir, please share, welcome, sir. Please share some views on this series.
Thank you, Pragya.
Welcome, sir.
Head of the department, Professor D.K. Yadav, distinguished speaker, Dr. Chandrasekhar Sharma, and Dr. Pankaj Kumar Seth, my distinguished faculty colleagues from Computer Science and Engineering Department and other departments. On my behalf and on behalf of the institution, I extend my warm welcome to all of you, including all the participants of this webinar. Yes, indeed, as has been said by my previous speakers, it's a high time to keep the mental and physical health up, keep the motivational level of all the all individuals in the society, not only in educational institution, but in and around us. We need to take care of it because it's becoming almost a year. We are fighting, we are struggling, we have passed through different phases starting from 23rd of March, and we have seen a lot of changes taking place in the society and in the system in general. One of the important aspect is that somehow India as a whole, we could not do that kind of thing which has generated fear. And it's a kind of fear which was generated earlier in the beginning, that we could see the migrant laborers starting from one place to another place, traveling on foot for thousands of kilometers. It was nothing like that. I mean, people were there to help them, people were there to support them, but it was just because of the fear. And fear to what? Fear to failure. That system has failed, nobody is looking after us, what will happen to me if something happened here, all those sorts of things. And it is very important, what I personally feel, that it is very important that fear to failure or fear of any kind, if it is generated, then it generates the negative emotions. And even the positive things which are happening in front of you or with you, you look at it from that negative emotion point of view, and you feel that nothing positive is happening to me. That is very important. And today, after a period of 1 year, whatever our government has done, uh, with lockdown, without lockdown, unlocking the lockdown, but to me, only two things which are very important, which has been done during the lockdown period, that in this big country, now each and every individual in the remotest part of the country is aware that what is corona, what precautions we have to take. That information has been disseminated well up to the end. And another aspect is that we have strengthened our medical infrastructure in all the aspects. So, with these two things, that needs to be communicated well in the society, so that there should not be fear. क्योंकि अगर आपका even if there is a corona positive and you take immediate action, nothing is going to happen. Don't worry. I mean, our medical infrastructure has been tuned up to such a way, and probably that's why things have started moving. And it is the collective responsibility of all of us, not an individual society or independent society. All of us, when I say, the important responsibility lies with the institutions like us, faculty members, students. We need to generate a kind of awareness, motivation, and the things that we should be able to counsel our vicinity. And if everyone starts working in their own swamp, things will be completely different. Many things we have already accepted, and the way in which we are meeting, we are interacting, that has given altogether a new norms in the society. And as has been said by Professor D.K. Yadav, that it has positive as well as negative. I always look at it as a positive, and every blessings in disguise that gives an opportunity. And I'm proud to share that within a period of 6 days after 23rd of March, we have been able to restore all our academic activities with the help and support from computer science people. And just I throwed a challenge on 23rd of March that what computer science master तुम लोग क्या कर रहे हो, इसको challenge की तरह ले और do it. And I'm proud to share that everything was done in a very nice manner. And on 23rd of March, I remember very well, where I took first class online with the total internal support. And online examination was conducted, then students were placed, a lot of innovative things have happened. And I'm proud to share with my honorable speakers that during this period, during this crisis period, we have been able to do the technology transfer, 3 technology transfers for the first time, and that too all was related with corona and medical things. So these are the things in short. And once again, I congratulate the department for organizing such an awareness program, and I extend my all good wishes to all the participants, and a special thanks to the speakers, Dr. Chandrasekhar Sharma and Dr. Pankaj Kumar ji, for for sparing the time and sharing their thoughts, experiences with the participants. And I'm sure that very soon we will get an opportunity to physically interact and invite you all in the campus. Thank you all. Thank you. Jai Hind, Jai Bharat.
Thank you, sir. Thank you, sir, for your nice suggestions. Now, I would like to invite the coordinator of webinar series from the INYAS side, Dr. Pankaj Kumar. He is a scientist in IUAC as well as the coordinator of INYAS Delhi chapter. So now I would like to request Dr. Pankaj Kumar.
Thank you, Pragya. We have already consumed 25 minutes, so I'm sure that we all are waiting to hear Professor Pankaj Seth. So I would introduce Professor Seth, and then we will start hearing him. Professor Seth has made pioneer contributions in understanding molecular mechanism of virus-induced neurodegeneration, particularly HIV and Zika virus. His laboratory at NBRC, National Brain Research Center in Gurugram, has developed a unique culture system of human brain derived neural stem cell. Recently, he has initiated work on novel coronavirus using human neural stem cell. Professor Seth has said work has been recognized worldwide, and he is serving as an editorial board member of several international journals, and he is also a member of task force of DBT ICMR. Further, he is fellow of Indian Academy of Science India NASI, which is situated in Allahabad, as well as he is fellow of Indian Academy of Neurosciences. With these words, I request Professor Seth to kindly share your presentation and start. Yeah, we have already done that. Thank you. Please start. Professor Seth, I think you are muted. You have to unmute and then start.
Yeah. So good afternoon, and thank you very much for inviting me as one of the first speaker of this important webinar series. I am also a son of soil from UP. I belong to Lucknow. Actually, my hometown Lakhimpur Kheri mein hai. And I'm very delighted that something of this important stature is being organized through MNNIT Allahabad and INYAS. This is very important to spread awareness, especially in terms of we all have seen so much. There's information overload now, I would say, from popular media, where it is very clear that SARS is known more like a respiratory virus. In other words, if you have SARS or coronavirus infection, novel coronavirus infection, usually people have problems in breathing difficulty and lung, and that is why the high mortality is there. Fortunately, as has been pointed out, that not everybody develops that problem of respiratory infection or respiratory distress, which is a blessing. But maybe there's one other aspect which not many people are known, and that is why I accepted this challenge to make you aware about that the SARS-CoV-2 virus or the novel coronavirus is more than a respiratory virus, and it also has a consequence on brain. Now, this effect is not of the psychological nature, which is because of infection and uncertainty after infection, but this is truly because of this presence of this virus has now been shown in brain of COVID-19 patients. And it has also been now observed that some of the coronavirus infection survivors or COVID-19 survivors will continue to or are continuing to show certain difficulties in their cognitive and motor skills or their normal brain functions. So I bring about some of an overview on this subject from National Brain Research Center, where I've been working for last 17 years. It's a beautiful lush green campus situated 40 kilometers away from New Delhi Airport at a small place called as Manesar, Gurugram. At National Brain Research Center, we try to understand how healthy and uh, diseased brain works, and we offer masters in neuroscience as well as PhD in neuroscience. With that introduction, I will bring you to my first slide, where I would like to say that this coronavirus is not something new. It actually appeared first time as SARS, then as MERS. It took almost 10 years to convert from SARS to MERS, reappear as MERS. But fortunately, these were not as lethal. But after 7 years again, in 2019, that came with a much devastation, which has affected the entire world this time. And we don't know when it will reappear again. And that is why it is important to understand what was SARS, what was MERS, and what is COVID-19. Now, something which has been found common in these three diseases or this syndromes has been that they have been jumped from the animal species into human. Okay, it was civet in SARS, it was dromedary camel in MERS, and now it has been believed to be pangolin or snakes in COVID-19. Now, what is also common between all these three diseases is that the carrier has been linked to the bat, which is another mammal, as we all know. So we don't know whether bat will continue to play this havoc, and that only time will tell. With this introduction, I would also like to now bring you to tell you कि ये SARS CoV-2 वायरस जो है सेल के अंदर एंटर कैसे करता है. We all know that the spike protein which is present in the virus look for a docking receptor called as ACE2 and another co-receptor TMP-RSS2 which is basically cleaving the spike protein, allowing the virus to enter, and then it causes the problem. And then inside the cell it usually multiplies and then exits out. Now, in addition to ACE2 receptor, it has also been found that some receptors such as neuropilin or NRP1 has also been shown to be important for entry of the virus. Now, I will not go into too much science of this, but bring you to next slide, which is directly related to the topic which I have chosen today. Now, if I hear directly from the COVID-19 patients, you will see that they are complaining now of a new thing called as brain fog. Now, what is brain fog? Is basically there is no clarity, and they have some common symptoms which have been reported in almost 40% of COVID survivors or COVID-19 patients is they have inability to calculate or do simple mathematics. They have difficulty in concentrating. They have burning sensation and tingling in their extremities, in their toes, in their fingertips, sometimes in their skin, and also they have some kind of confusion. This is also during their infection when they are having COVID-19 symptoms, but also up to 3 to 6 months after they have recovered. And this list continues as the COVID-19 patients show neurological complications, and that is why we are discussing all this today. And as I said, up to 40%, which is a huge number considering the number of people which have been infected worldwide, that out of that 40% of these patients are exhibiting neurological complications. Now, if brains does not work properly, even after recovery, your quality of life will have problems. And the usual symptoms which are being reported are headache, loss of sense and smell and taste, which actually recovers in most of the patients, but sometimes it is continuing, and that is a concern of worry. And there's confusion, there's dizziness. These are some symptoms which are also coming to collectively in as neurological complications in these patients. And these continue. What is worrisome is that they are continuing even after the recovery of the COVID-19 patients. And that is why a new term has been coined as neuro-COVID. So neurological symptoms in COVID patients is called as neuro-COVID, and this science or this new field is now quite developing. So What are we seeing under these neurological complications? There's a higher risk of stroke in these COVID-19 patients. Sometimes some people which are reporting in stroke clinics are then found to be COVID positive or SARS-CoV-2 positive. So there's some relation between this virus and coagulopathy, as we call it, where it is inducing increase in coagulation of these, and sometimes there's also hemorrhage, so there's micro bleeds in the brain. There are motor and sensory deficits which are also seen in these patients. There are seizures reported in COVID-19 cases, and the areas affected are more in the region of olfaction. And olfaction means that is why it is also having problem of loss of sense of smell. Now, if you look at this picture, which was recently taken from CDC, you see that in COVID-19 and seasonal flu, if you have to make a distinction, what is striking is in COVID-19, you have some of the things are very common between the two major infections. But in COVID-19, you will first find fever, headache, and again, as I said, loss of taste and smell. I am bringing this point again and again, and this has now been also added as one of the symptoms or for detection of COVID-19 by both by WHO as well as CDC in COVID-19 patients. Now, this is actually telling you that there's a neural involvement or there's involvement of the mucosal membrane, which is important for olfaction. Is that true? Is the question. So way back in April 2020, when not many people were believing that there's any involvement of brain in COVID-19, we came out with a review, a comprehensive review, which we had submitted earlier in April, that the olfactory nerve sheath, which is there, this is part of the nasal passage. These are the olfactory neurons, lamina propria and cribriform plate, where there's loss of blood-brain barrier. I'll talk about this. And this is part of the brain. So this is possible route of infection, how the virus is reaching the brain. This is one way. The other way is that when you have the blood capillaries, if the virus is present in the blood capillaries, it can pass through the blood-brain barrier. There's a barrier which is a selectively permeable barrier present naturally in the brain, and that protects the brain from ills or toxins which can come from blood into the brain. That barrier protects the brain, and that is why it is called as blood-brain barrier. Now, what happens? This virus has somehow figured out to open up this blood-brain barrier or break this barrier and reach into the brain parenchyma. And it is found to be present in neuron and glial cells of the brain. So there is one way it can come through the olfactory mucosa sheath. It can break the blood-brain barrier, and the rest. Other thing is, most of you would have also heard that people with COVID-19 also have diarrhea. So usually they have an enteric epithelial cells which provide a tight junction, and things which are there in the gut usually do not come into the circulation. But in this COVID-19 patients also it has been found that this virus breaches this barrier also and can come through the vagus nerve as well as other connections, and we all know that there's a connection between gut and brain. This uses that route also to get into the brain. So these are various ways by which the virus can get into the brain. So the next question is, does virus actually get into the brain, or we are just assuming these are hypotheses? So now there are many evidences from autopsy tissues or autopsy studies which have been conducted in China, Germany, and certain other nations, where there is now concrete proof that the virus actually reaches the brain. And it has been seen by electron microscopy that the viral particles get into the brain. And the maximum damage which has been found is in the olfactory system, or the olfactory pathway. You are seeing here a nerve, a tissue, which has the presence of virus particles over there, and it damages the tissue. And that is why perhaps the sense of smell is going away. Now, should we worry about it? Yes, of course we should worry about it, because it is okay for those patients in which it is coming back, but in some cases it does not come back, and that is a point of worry. So what are the possible mechanisms by which the virus is getting into the brain? As I showed you in that other slide, which came from my review, there are other evidences which are suggesting that, because you would have all heard about the term called as cytokine storm. So there's a huge increase in number of inflammatory cytokines and chemokines which go up in the blood vessels, and that is why a lot of people have problems. But this increase of cytokines, chemokines, because this blood also goes into the brain tissue, it goes there, and these cytokines, chemokines then open up this blood-brain barrier, which is a collection of endothelial cells and astrocytes, a tight junction. That tight junction is loosened up, and these inflammatory cells get into the brain. Now, inflammatory cells should usually not be there in the brain, and the problem in the brain is because brain is kind of surrounded by the skull hard tissue of bone. There's no room for it to inflame and expand. So if there's brain inflammation, it actually results in the rupture of the some cells and crushing of the brain tissue, and that is what is causing problems. Headache is one problem. As far as it is temporary and small, it's for small duration, it is okay. But if it continues, and that is where some of the problem of neurological complications are arriving, and some of these patients may continue to have show these neurological complications. That will depend on the degree of damage to the brain because of inflammation, and that is why it is worrisome. Again, there are multiple now evidences which are coming from autopsy tissue or post-mortem sample that the virus is undoubtedly now present in the brain, as is shown with these black arrowheads, that the viral particles is very much present in the blood-brain barrier and certain tissue and nerve fibers in the brain cells, which again is indicating that the presence of virus is there. Now, it is okay if the virus gets into the brain and it is cleared off, but the problem is it is not cleared off from the brain, and that is going to be a problem in long term. And now the field of neuro-COVID is investigators like us and many other in the world are trying to understand how to clear this virus from the brain, so that the problem in the COVID-19 recovered patients, this thing is not there. Now, how do you work on this COVID-19 or the SARS-CoV-2 virus? So various ways are nowadays, people are making small mini brains, as they call it, in petri dishes. They can make of certain particular areas like cortical organoids, hippocampal organoids, hypothalamic organoids, midbrain organoids, and they are also deriving certain cells from the brains, from the blood. You can make brain cells also. I won't go into those details, but just wanted to tell you that people are working on brain cells as well as brain organoids to understand how SARS-CoV-2 infection is causing problem. So with various ways and various evidences, they have now shown that the virus is present in the brain. So the brain organoids are mini organoids, mini brains. If you infect them with the virus, astrocytes, neurons, both are being infected. Okay, and there are very beautiful experiments which have now shown the presence of the virus in different cell types of the brain, and which is again worrisome matter. In cells as well as in brain organoids, infection of the virus has been shown, and these are just observations now, and now people are trying to understand the mechanisms by how the virus is there and what is it doing after it is there. Is it killing only neurons? Is it killing only glial cells? And by various antibody staining, like here they have stained with the M protein of the virus shown in red. It is showing that the virus is there in the brain spheres. By other protein as spike protein also, there is evidence that the virus is there. So there is undoubtedly more and more evidence coming every day, both by experimental studies as well as by post-mortem studies, that the virus makes its way into the brain and it causes damage to the brain cells. Now, other cell type which has also been found in a mice model where they had expressed human ACE2 receptor, which is an important receptor for this virus to dock and infect, that the microglial cells are also involved in and microglial cells are some cell type which basically cause more and more inflammation. So in other ways, we are now understanding that indeed the brain cells are being affected because of inflammation. A study by Canberg et al. Has also shown that plasma biomarkers have been seen, that if you have a long-term injury in the COVID-19 in the brain of neuronal injury, it can be picked up in the plasma by looking for markers such as neurofilament light chain or GFAP, which is a glial fibrillary acidic protein, a marker for activation of astrocytes. One of the most abundant cell type in brain is astrocyte, and this GFAP is a marker for that. So if these GFAP cells, which is astrocytes, get infected, there's increase in this marker levels, which is reflected in the plasma membrane, in the plasma of these patients. So what I'm trying to say is, with all these slides and evidences, is that SARS-CoV-2 is more than a respiratory virus. It is affecting the brain of these COVID-19 patients. I'm not trying to scare you, but I'm trying to educate you with the fact that it is not, even if you recover from the COVID-19 and lung infection, there's a possibility that you may. So this is more of an awareness lecture where I'm trying to make a point that if you feel, or if somebody in your family or friends, if they're COVID survivors or COVID-19 patients, ask them if they're having a problem with agnosia or agnosia, which is basically smell and taste, loss of sense of smell and taste. People are seeing problems in the peripheral nerves of GBS, which is another syndrome. There is neuron and glial necrosis, there's muscular pain, there's hemorrhages and stroke, there's encephalitis and meningitis. These are severe parts, but what is usually indicative of involvement of brain would be if you have a loss of sense of smell and taste. So look for these symptoms, consult your doctor, inform your doctor that I'm having these problems, so that doctors can attend to it and you can get the right treatment, while people are trying to find treatments for those. But symptomatic relief can be given to you by proper treatments. Now at NBRC, what we are doing, we are trying to understand how the SARS-CoV-2 virus is affecting the brain cells, and the model system which we are using is we derive human fetal brain cells. And what we are trying to do, we don't work with the virus, because there are a lot of studies that the virus is there in the brain. Now we are going to do a breakdown, because which component of the virus is causing problem is what we are going to study. How we are going to study? We are going to use this neural progenitor cell or neural stem cell model system, where we can grow brain cultures of fetal brains, both as monolayers as well as in sphere-like structure. And then what we plan to do is we will transfect and overexpress certain proteins of this virus and see which protein is causing the problem, which are leading to those symptoms of neurological complications. So this model system we've used in various ways, which basically gives you neural stem cells, as well as you can differentiate cells from there and make different type of brain cells, because they are neural stem cells. And we plan to use this model system, which we have used and published a lot of work out of using this model system in understanding how HIV and Zika virus bring damage to the brain cells. And now we will use SARS-CoV-2 viral proteins and study how those proteins are affecting the brain cells. And the beauty of this model system is that as they are stem cells, you can study the effect of the virus on stem cells, or you can differentiate neurons and astrocytes. Neurons are shown in green over here, and as you can see, these green cells indicate that the new neurons, human neurons, are being made. If you put viral protein here, you can understand whether this new neuron synthesis can be blocked, or is being affected, or neurons are dying. All those things can be studied by those viral proteins. So we are going to use this model system in understanding. So as I said, these neural stem cells can be differentiated into astrocytes or can be differentiated in neurons. So we can study the effect of viral protein on stem cells. We can study the effect of viral protein on astrocytes or on neurons, as well as if process in which neurons are being made. So in the process of neurogenesis or in the process of astrogliogenesis, if you put viral proteins here, we can understand if it is affecting the process of making of new astrocytes or making of new neurons. So there's lot good things happening at National Brain Research Center. So what is the potential of this neural stem cell model is, it can study the effect of HIV on stemness, effect of HIV in neurogenesis, effect of HIV in astrocytes, and in brain both astrocytes and neurons are there together. So how astrocyte and neuron crosstalk or interaction is affected by viral protein can be studied by HIV, by Zika, and now by SARS-CoV-2. So this is what I wanted to educate you with today, that there is growing evidence that SARS-CoV-2 and brain connection is there. Most of the knowledge is mainly based on case studies, some post-mortem studies, and experimental studies are in very early stages right now, and they are picking up, and they are mostly done by inducible pluripotent cells or organoids, but detailed mechanistic studies are still required. In other words, what we don't know is what part of the virus is doing. Is it the spike protein? Is it the M protein? Is it the ORFs? Which part of the virus is causing damage to the brain cells? If we understand that, then we can design therapies against it. So one best way is to block the virus to get into the brain. If you do that, then none of the things are required. But that is not possible because virus is reaching the brain by different ways. At least what we know today is through the olfaction or the your respiratory method, your nasal method, your blood-brain barrier breaching, as well as from your gut. So blocking the virus is very difficult. So now we have to prepare ourselves that if it gets into the brain, what component of the virus is causing the problem. So we are geared up for that. And so thank you so much for your attention, and I'll be happy if there are any questions.
Thank you, Professor Seth. If anybody has any question, please unmute yourself and ask the question.
Sir, I have a question.
Please go ahead.
Hello, sir. Good afternoon, sir. Sir, I just recovered from COVID-19 5 days ago, and so when during the COVID period when I came to know that I am positive, so I had a headache, and I'm not I'm recovered, but still I sometimes got a very long headache. So, but my question is there is a relation between like asymptomatic patient also have the same neurological infections? Because I was asymptomatic, I didn't know that I was positive. The
So why,
test when the test happened, then I came to know. Otherwise, I didn't have no such symptoms.
so why was the test done?
Sir, because my mother was tested positive, so other family members were also tested. So I was tested positive. Then I came to know.
And
Other family members
when
were
did the headache start?
uh, started after 2 days ago when I came to know that I'm a positive. And yeah, and
So
it's still and continues sometime. Today I'm feeling better, but yesterday and day before yesterday it was all day like something was going in my head.
do you have any? Could you smell things and taste pizza and pasta and butter chicken?
No, sir. If I'm able to see, then I can only realize that what I'm eating. But otherwise, if I'm not, if I don't see or close my eyes and eat, then I cannot differentiate. Now I'm better. Some taste buds are getting, like they are getting back. But when I was during the isolation period, I had lost my taste buds also.
So I'm glad you brought this up because you proved what I was trying to tell you everybody, that there's an involvement of brain cells. So you don't have to worry because you will get better as time passes, because the olfactory sheath what we have has a very good possibility of regeneration.
Yes, I was. During all this lockdown, I have seen many reports. That's why I'm attending this seminar. That it has some effect on brain. That is why the
Yes,
reason I was attending.
yes. So my point is that you will get better as with every passing day. What you have to do is continue to watch your symptoms, and your headache will also go away as the inflammation in the brain comes down. And there is
Okay.
some damage of your neurons which will recover because you're young also. And
Yes,
this
sir.
will be difficult in older patients. They will also get better, but it will take longer.
Okay, sir. So, sir, my question was that is there asymptomatic patient also have the brain neurological infections?
Yes, yes. See, your headache is, you can't call yourself asymptomatic.
Okay.
Your headache is a symptom. Did you get fever also?
I get when I was tested positive, 5 days before I had fever, but I took the medicine and then it was all right.
So,
You're
5 days
so,
before.
symptomatic, Akshita.
so you're not asymptomatic, beta. You
Hmm.
are symptomatic. Even in
Okay.
asymptomatic patients, there may be some involvement. Not
Okay,
everybody
sir.
has brain issues.
Okay, sir.
50% will have. Okay.
Sir, sir, I also the doctor which calls us to know our report, a daily basis report. I told them that I am having headache, so they said that this is due to the weakness and you will get all right. This is not to worry about. They told me.
Yeah, so eat well, eat huge amount of proteins. If you are a vegetarian, you eat soybean or whatever you like. Anything, you are an educated person, so eat as much protein as you can. That will
Okay,
help
sir.
you to build up your immune system
Okay,
and
sir.
of recovery of your whatever tissue is damaged. You will get better in 10 to 15 days.
Okay, sir. Thank you, sir. Thank you so much.
Yeah, good, Akshita, that you brought it up. So, to just to extend her question, I was also wanted to ask that the case studies which you have done or others have done, it was done with the hospitalized patients who were severe, or uh, the people who were at home. I mean, home quarantine people.
So most of the postmortems studies which I showed you evidence was of people who died in hospitals.
Oh, I see. Okay.
Okay.
Hmm.
So, but there are certain people who were home quarantined also, which later started to show problems of brain, such as
Mhm.
seizures. Some people developed stroke.
Right.
So that is why they say that if you know that you are COVID positive, then you should actually, as soon as possible, you should seek some medical help and continue to watch yourself. And if there's any comorbid conditions, as we all know that then you
Hmm.
need perhaps hospitalization, so that you are more closely monitored. Very recently, there was a TV program in which Dr. Guleria, the AIMS
Hmm.
director, New Delhi, Dr. Naresh Trehan, and then one consultant from Bombay, Dr. Hemant. They have um, they have a very beautiful program. I will share that video clipping with you,
Yeah, please.
which very closely tells about what we have to look for in COVID survivors.
Hmm.
So whether they are asymptomatic or symptomatic, they have to be followed up for 3 months to 6 months. They should not immediately start exercises because there is a possibility of a sudden heart attack or a stroke in such patients. Okay, so I will send you that clip, Dr. Pankaj, and maybe you
Sure.
can circulate if you like it.
That would be nice. In fact, to further add on it, I heard that the AIMS Trauma Center now has opened a section on post-COVID treatment BARD kind of thing. So there are a lot of
Yes.
patients who are coming after recovering. They are coming back and they are having these treatments
See,
treatments
if you
done in AIMS.
remember, we all would have heard it in news that our honorable Home Minister Ji
Hmm.
Amit Shah ji,
Correct.
after he was discharged from Medanta, he had to readmitted in AIMS for
Hmm.
his post-COVID symptoms. So, I'm not scaring anybody, but
Hmm.
since this is an awareness series, after recovery also one should very carefully watch, because our body talks to us every day. When you get up, you you will know how you are feeling today, है ना?
Right.
तो अगर आपकी बॉडी आपको बोल रही है कि आज आप 100% नहीं फील कर रहे हैं, राइट? सो just what I am trying to say here is, nowadays it is much more important that we more closely hear what our body is trying to tell us, and eat healthy, as was told in the introduction. Exercise, but not for COVID-19 patients. Before you get COVID, it is advisable that you exercise, breathe, do breathing exercise, do lung exercises, so that even if you have any problem of COVID-19, your symptoms will be minimum and your recovery will be faster.
Correct. Okay, so any other question? I can see somebody
I
raising
have
hand.
one question. So,
Please go ahead.
sir, actually, this infection, I have read that this COVID infection, once it is there, after maybe the person become asymptomatic, after some time it is, re-emerge. Uh, so that in that time, when it is going to be in the quiescent state, is there, the infection on the brain is going on, or what is the status of it, of that particular thing?
See, we don't know much about this virus right now, but I'll tell you another virus which is neurotropic virus like HIV. लोग बिलीव नहीं करते थे कि HIV, a virus which usually attacks the immune system, जिसका नाम ही है AIDS is acquired immunodeficiency syndrome, right? इसकी एंट्री AIDS पेशेंट्स में फर्स्ट एक्सपोजर के within 1 week to 2 weeks में हो जाती है ब्रेन में. So I have a feeling that this SARS virus also, whether people are asymptomatic or symptomatic, if they are exposed to the virus, some virus gets into the brain. Now, the appearance of the symptom of neurological complications will depend upon how much virus has got into the brain. If it is little bit of virus, brain will tackle it. But if it is too much of virus, then
that is my question. So we need what is the minimum viral load in our body so that it will get infected? Because once it is, maybe after treatment, maybe the viral load goes down. So if we know what are the viral load that is required to have infection in the brain, so we can monitor.
So there's no defined viral load. Nobody
Right.
can tell you how many viral particles or what viral load will define the neurological complication. It will also vary from person to person. Now the question what you raised was very nice, that people get symptomatic, they recover, and then they again have problems. So point of reinfection is still debatable. There are some cases of reinfection, but the reappearance of symptom does not mean reinfection. Reappearance of symptom is basically that if you do not take care of a body while you are recovering, you will continue to have weakness, your immune system will be down, and you may have some other infection also, co-infection. Now, for neurological complications, that is why I am trying to tell you is that if you see the symptom first time, you should be very sure that you have some problem in terms of neurological complications. I am saying that their virus presence is there in the brain. Now, unfortunately, while virus can get into the brain, lot of drugs cannot get into the brain because of the same blood-brain barrier. Virus learn to cross the blood-brain barrier, but these neurological treatment drugs do not know how to cross the blood-brain barrier. And that is why treatment of neurological complication is anyway very difficult. Okay. So that is the point I can just elaborate.
Yeah.
Otherwise, we can just continue on this debate.
Thank you, Professor Seth. And thanks, Vishwanath. Thanks you joined from Central University of Rajasthan. I know you. Okay, the next question is by Manasi Devnath. She is from Nehu, Northeast. Manasi, ask your question, please. Yeah, go ahead, ask your question.
Type of neurological problem that may affect the memory by causing that and
Mansi, we cannot hear you. Mansi, we
Can you
cannot hear
type your
you.
question in the chat box?
Yeah, please type your question so that we can read and ask Professor Seth to answer you. In the meantime, I would request Dr. Mukherjee from Dehradun. Please, sir, ask your question. Dr. P.K. Mukherjee.
Hello, Professor Seth. Hello, Professor Seth. It was a nice and educative talk, and thank you very much for that. As you said that this virus is very much similar to HIV as far as the brain infection is concerned. So my question is, does this mean that the antiviral medicines like Remdesivir and others should work well in reducing the infection?
So I cannot say if this virus is similar to HIV virus infection, but I was trying to emphasize that it uses the same strategies to get into the brain.
Yeah, mechanism,
So,
I mean, yeah.
yeah, so that matter, lot of these antiviral, anti-HIV or antiretroviral drugs are also being trying to be repurposed for treatment of COVID-19. For that matter, they have been trying to do that, but there's not much success. And what we are understanding now is that, like for any virus, we have to attack the multiple replicative step. Either it is during the fusion, we can try to prevent it, or during, when it is, reconstituting the viral protein so it can make a mature virus, or when the nucleic acid is being replication is happening in the host cell. So we will have to attack at different steps, exactly like in HIV. Fortunately, SARS-CoV-2 is not mutating as HIV was doing, so tackling this virus which may be easier and vaccines would be possible, unlike in HIV. So that's the
Thank
positive.
you. I think still it's not very clear whether such antiviral medicine would probably reduce to some extent the degree of infection.
So degree of infection, sir, as I said, the repurposing of anti-HIV therapy has also been tried. But the problem has been, as in HIV cases, in neuro-AIDS cases also, the antiretroviral drugs could prevent the replication in the systemic system. In other words, in the blood, it could clear all the virus. But the same anti-HIV drugs could not clear the virus from the brain because these were not able to cross the blood-brain barrier. The other issue was in HIV that the anti-HIV drugs were made to tackle the replicating virus. However, once it gets into the HIV does not replicate in the brain that much. So even if you pass the blood-brain barrier and you push these anti-HIV drugs into the brain, because they are designed to attack the replicating virus, the clearance of the virus from the brain has not been possible using anti-HIV drugs. And I think that will be continue to be the problem with SARS-CoV-2 also, because there's a possibility that when it gets into the brain, it will not multiply that much. And if it is not multiplying, then usually the antiviral strategies are on attacking different steps of the replication. And if the virus is not replicating, then these drugs actually may not be that helpful. So you will end up doing the symptomatic treatment, trying to reduce the inflammation or the consequences of the presence of the virus rather than tackling with the virus per se.
Thank you very much.
Yeah, thank you. Thank you. Next, Mansi is asking that whether this virus has impact on memory system. If so, how much it can recovered?
So, as I said, memory recall has been said to be one of the symptoms now. Now, it will again depend on the extent of the damage. The issue again is that how much neuron is damaged. And as we all know, neuron being a terminally differentiated cell, if it is damaged, it is very difficult to replenish that damaged neuron. So depending on which area it is being affected. So some people are now also saying that their involvement of frontal cortex, which is basically the area of forebrain, which is important for the cognition, where the cortical region is mainly for the memory, recall, and formation. So fortunately, as of today, no major dementia-like symptoms have been reported. But yes, memory recall and concentration is an issue, which is so far temporary. But because this is again a very new virus and it's only, I would say, 8-9 months, so we don't know. These things will show up only in later studies and in the long run, right? So we haven't seen anybody developing dementia as such by COVID. It may have been aggravated in some AD patients, or in ED patients also the damage is sooner or more if they also have COVID-19.
Yeah. Okay. Another question is that we have all heard about the comorbid conditions. Somebody has heart problem, or diabetes and all. I mean, for them, this virus is dangerous. How about the people who are already suffering with neurological diseases, neurological problems in terms
So
of
as I
brain, especially? Yeah.
Yeah, as I said, so if a PD patient also contracts COVID-19 infection, the damage is much more faster. In fact, one of these postmortem studies which I have shown and case histories which I have read is has a mention of a PD patient, which was a PD patient and he contracted COVID-19 infection, and then he died of that, and those who are surviving also have much more severe uh, symptoms of whatever pre-existing disease they had, which is basically aggravated. So the damage is like 1 plus 1 is not 2, but 1 plus 1 is now becoming 4 or 5, because it basically shakes up the entire system of the brain. And most of the damage, unfortunately, to brain is usually more of a permanent nature rather than and again, age is a factor.
Correct. And any other question? So this imaging is done with what? I mean, if you want to study that the effect of COVID on brain, which device you use?
So in live patients, usually people are relying on now something called as DTI, which is diffusion tension imaging, where you can actually follow the tract, and people can also look at by using different contrast, look for more damage in the areas, and something like when we have to detect MS, which is multiple sclerosis and other such diseases, usually MRI and functional MRI are what are usually employed, and perhaps these tools will come useful also for understanding in COVID-19.
Correct. Any other question anybody has? Please unmute and ask your question.
Sir, thank you for
Yeah.
your valuable information. I just want to know that if someone has not tested, someone is asymptomatic, but somehow, someday over a time, he has developed those neurocognitive uh, uh, these functionalities like brain fog or difficulty in concentration or forgetfulness. So, is it suggested that he or she should test for COVID?
It all depends, this neurological complications may show up even after you've recovered from COVID. So if you do an RT-PCR that time, you may turn negative.
Okay.
So, but if you have any neurological complications, nowadays anyway, people get you tested before they admit you. So you will know if you are actually active infection at that time, which will show up only by RT-PCR or rapid antigen test. But to be sure, if you're negative for rapid antigen or RT-PCR, then one can actually look for antibody test, IgM, IgG test, and if those are positive, that will indicate that the neurological complications are because of COVID-19. But I think that will not be a point that you want to prove why it is there. As a clinician, somebody will like to try to treat, and only if they want to find a cause why you are having the neurological complication. So in an aged person, if somebody has a complication, they will think this is age related. But in a young person like students we were talking about at 20, 25 years age, if they have neurological complications, one would like to know what is the cause. And either they will test RT-PCR positive if they have an active infection, or if it is later, maybe one can do an IgG test on them.
Thank you, sir.
Yeah. Any other question by anybody else? Okay.
I think no questions.
Yeah, so we will now wrap up. I am happy to see that Professor Amit Roy, ex-director IUAC, has also joined to listen. Thank you very much, sir, as well as all other participants. Now I would request Mayuk. Mayuk, would you like to say, would you like to thank everyone at the end? And
Thank you, Dr. Pankaj Kumar. Uh, our Honorable Director, Sir, Honorable Chairperson, Head of the Department, EQI, Sir, respected Speaker, Dr. Pankaj Seth, our senior faculty members, my colleagues, respected participants from INYAS and invited guests. It's my privilege to have been asked to propose a vote of thanks on this occasion, especially on a subject which has not only taken millions of lives, which has also created a global pandemic. I, on the behalf of CSRA department and the MNNIT Allahabad, and on my own behalf, extend a very hearty vote of thanks to Dr. Pankaj Seth for such a valuable insights about its consequences, about the consequences of this COVID-19 on brain, and that it is, and to show that it is not just a respiratory virus. In fact, several neuro functionalities that can occur uh, even after the recovery from COVID-19 shows us that we must be more cautious about this pandemic. I also extend our sincere thanks to INEAS for their enormous cooperation in the organization of this event. I wish such cautiousness in every individual will be the key step to free this world from such a pandemic and thereby providing us with a happy world. Once again, I thank you all for your valued participation. I hereby would also like to inform you that this webinar series will continue with this highest hope of success in the same way as we have achieved today. And our next webinar will be on 21st November 2020, and its details will be posted at later stage. I heartily like to invite all of you and wish your kind and valuable presence in the same. So I'll mark this end of vote of thanks with a hearty wish for a pandemic-free life for all of you and thanking all of you. Thank you.
So I think thank you all of you.
thanks. Yeah,
So I think we should stop
Thank
this.
you.
yeah. Stop the recording first, probably, and then we can leave.
Okay.